Allison, you're not muted.
Okay, thank you. I want to welcome everyone to this meeting and call to order this meeting of the Health Occupation Subcommittee of the Health Committee of the House of Delegates. We will be meeting for 30 minutes, so we're going to adjourn at 20 minutes after 2 to enable the Pharmaceutical Subcommittee to meet and to have a quorum when it meets prior to the full committee's meeting at 2:15. Okay, we're going to begin with House Bill 1047, State Board of Physicians Delegation of Duties, alterations. Delegate Hutchinson, this is your bill, and there was no opposition at the hearing. And there is an amendment to increase didactic hours.
Move the amendment.
No, actually, that amendment, we're not accepting that amendment.
I see the further notes. Yes.
Yeah, that was a last minute amendment that the ASRT threw in there, but we already established the adequate amount of hours that are needed, both didactic and training wise. So that's
we
not
hear
accepted.
you. Okay, so that amendment is not being offered at this before the subcommittee.
That is correct.
Thank you. Is there a motion then on the bill?
Make a motion to move the bill.
Motion is moved and is seconded. Is there discussion? Any discussion on the bill? Delegate Zaliga.
Thank you, Mr. Chair. Delegate Hutchinson, is MedCai on board? The radiologist, everybody's good with this?
Yeah, actually, it was RadNet and the radiologists who were opposed to the bill 2 years ago who came and offered the bill. So it's actually their bill that I'm representing this year.
Okay, thank you.
Okay. Any other questions, comments on the bill? Okay. There is a motion for the bill for favorable. All those in favor, please signify by raising your electronic hand. There are 6 votes in, 7, Delegate Lopez, slow but countable. 7 votes in favor. Are there any votes against? Again, please raise your hand if you are against and lower your hands now if you are in favor. Delegate Tavares, you voted in favor of the bill, I believe. Okay,
yeah,
so
it was 7 in favor, and there's only 7 people on the subcommittee.
Okay, well, that's good math. Okay, the bill gets a favorable. 1135, health occupations, pharmacists, vaccination orders, Delegate Lopez's bill. And are there any amendments to the bill?
I circulated an amendment suggested by Chair Bagnall that alters the reference to administration by an adult caregiver to be by a parent or guardian. There were some questions that came up in the bill hearing about that language. Caregiver matches other language in the statute, but there was some concerns about it being like a parent or a guardian of a minor instead. And I will note the Finance Committee has voted this bill out favorable, so with no amendments, 8-2. And it's on past second reading in the Senate.
Do you know if this amendment was considered by the Senate?
I don't think it was.
It should not be controversial, however, and when the time comes, if needed hopefully they would concur in the House amendment. Delegate Lopez, you may know more. You are muted, so we can't learn your wisdom.
My button. I apologize.
No
I'm
problem.
very quick over here. It's the computer. It's not me. Out of an abundance of caution, we wanted to include this amendment just to give people a sense of safety and that their concerns were heard. It's not necessary. This amendment was not considered in the Senate, but we feel like it is a nice thing to add on to it. So that was the reasoning.
Okay, so there is a motion for the amendment. Delegate Zaliga.
Tell me again, Delegate Lopez, it clarifies what a caregiver is.
It says parent or guardian.
Okay, thank
And
you.
Lindsay, correct me if I need to be corrected, but I think just parent or guardian.
That's right. So there's a specific reference to the administration of the flu mist, essentially. And so this would be administration by a parent or guardian, rather than saying administration by a caregiver.
All right, move that amendment.
Is there a second? Okay, Ms. Kuzak, do you wish to comment? You are muted. Unmute yourself and start. Okay, go ahead.
I'm sorry. I just wanted to comment. I'm with the Alliance for Science-Based Policy that we very much appreciate this amendment. We think this was very needed. One other thing that we would like the subcommittee to consider is an amendment to clarify that this is for the flu mist. Ms. Rowe just said flu mist. All of the testimony was given about the flu mist. The company who makes the product came to testify and talked about flu mist. So we would like that also clarified in the bill.
Have you drafted an amendment?
No,
No.
but we'd be happy to work with anyone willing to do that.
Delegate Zaliga.
Well,
Hand is raised.
thank you. Yeah, let's move that amendment, and then I'm going to offer that amendment from Ms. Kuzak. If you want to do that, Mr. Chair, let's go.
Oh, okay. So that's true. What the amendment that is before us is the parent or guardian limitation to who can administer the vaccination. All those in favor?
We had a second, yes.
Yes. All those in favor say aye.
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 Is there anyone opposed? Okay, that amendment is adopted. Delegate Zaliga.
I'd like to offer in concept to that amendment that we just spoke about that would add the actual flu mist, so we know that's what we're talking about. It doesn't get expanded.
So that you want an amendment that would limit the provision. What would the flu mist be replacing in the bill? How would it?
I'm looking. Lindsay, do you see a parent or guardian?
Yeah, I think it would involve restructuring the bill, because right now this is relating to a variety of different vaccines. I did say flu mist, but it could potentially apply to some other vaccine that gets developed in the future as well, that is, administered nasally. And so it would require some restructuring of the bill, but we could do it.
Delegate Lopez, you are the sponsor of the bill. Do you have comments on the proposed amendment?
Yeah, I think that it gives me pause to specifically say the name of the product. However, saying that this is a vaccine that is administered nasally, I'm loosely fine with that. Someone can give me more color as to why that might be a bad idea. But if the idea is that we're trying to provide essentially a mist that can be given nasally as opposed to getting a jab in the arm as a way to manage public health, I'm fine with that. But I don't want to put the name of a specific product in statute. I think that's problematic.
I think Delegate Lopez, that's exactly going there, where it's not going to allow, injectable vaccines to be used, that the purpose of this was that. Yes, thank you.
We just had a floor debate on a related issue in terms of the name of a company. I listened. So Delegate Lopez, where are you on an amendment on this amendment or a modification of this amendment?
I would be fine with amending this bill to be broadly about nasally administered vaccines. However, that is defined within the pharmaceutical industry, that's fine. I don't know. I looked to Lindsay and she looks concerned, so that makes me feel concerned.
It's my thinking face.
Okay.
I'm thinking that on page 2, line 20, where it says or ordered for administration by an adult, it says adult caregiver, you've now changed it to a parent or guardian. If we changed that to nasal administration, I think that that might cover it, because that's really the only place where the bill is
referring to
the method of, where the method of administration might be included here. But I see there's other folks with their hands raised. They might have thoughts on it.
Ms. Sanchez.
Hi, good afternoon. Thank you. So we actually have been working with the sponsor on the bill, and some of this discussion did come up on the Senate side and were roundly kind of rejected. But I think that this is the caregiver portion. I also have my hand raised on, so I'll just kind of comment on that, which is fine. We just were concerned that because it's already in statute, what that would do for vaccines and things that have already been a caregiver is already used, whether that would create an issue, but that's done. The actual language of having flu miss in the code, I agree that's probably not ideal, considering that the code usually avoids naming specific businesses, and if that name were to change for whatever reason, that would create an issue. I think generally adding an intranasal administration of the vaccine, because that's really the only difference, is that it's being taken intranasally, is not ideal, but if that is the will of the subcommittee.
Why is that not ideal? Or what?
Because if it changes in a different way, like if it's changed to a different modality, like if science improves and now it's able to be given maybe with a pill or another modality, then we will be back before the subcommittee requesting that there's a change, because it's now been put in statute that it's intranasally. So that's why it's not ideal, but it's not enough to kind of, create a huge problem if it is the will of the subcommittee.
Okay, thank you. Ms. Horton?
Hi, yes, I just wanted to piggyback on Dolores' comments about that. So going into that level of specificity about a specific name drug, we wouldn't want to do that. There are currently 3 intranasal vaccines that are in the process of going through approvals. And so if those were the case, we'd have to continue to change every single time. So it's really about the method and the pharmacist's scope. And I did want to mention that there are other self-administered vaccines in pill form, in liquid form, and there are also patches on the market. So I think just keeping it broad for self-administered meets the needs for scope. And that's what this bill is about the ability for pharmacists to be able to dispense the vaccine, sorry.
Delegate Riley, thank you.
Thank you, Mr. Chair. Yeah, originally my hand was up to second that amendment, but now through the discussion, I'm still comfortable with having it more defined instead of, open and broad. But I do agree we don't want to add, the actual name, but I would be good with some type of nasal vaccination. And then if we have to do something for a patch or a pill, then yes, that's the process. We come back. That's just my opinion. So.
Thank you. Ms. Kuzak?
Thank you. I totally agree not to put the product name, the company name FluMist. So maybe if it was an intranasal flu vaccination. And we also would agree if there is a new modality in the future, a patch or a pill, that is unprecedented. That would be brand new. And you're talking about a parent administering, not a trained, licensed healthcare provider. So I think that would need to come back in front of the legislature and start all over. That is something totally new.
Okay. Ms. Horton, very briefly, since you've been recognized before.
Sure. I just wanted to mention that these other vaccines that are in the pipeline are not just for flu.
they're for other disease states. And so we wouldn't want to put in specificity there. If we're talking about vaccines, we're talking about vaccines. So.
Thank you. Okay, what is before us is language that would add to the bill that a nasal application.
Can I actually interject?
Sure.
So I think looking more at the bill, I think for clarity, on page 1 in line 16, we could specify a vaccination for, and from what I'm hearing, I think intranasal administration. Or administer a vaccination. And then on page 2, where I noted before, line 20, or ordered for intranasal administration. Just to be clear, I think intranasal sounds to be what I'm hearing to be the specific term that would be appropriate here. So 2 locations.
Okay. That is the amendment before us.
Move that amendment.
It is moved, and is there a second?
Yes, second.
There is a second. Ms. Kuzak, could you lower your hand, please? That's okay. All those members who support the amendment, please indicate by raising your hand electronically. There are 4 in favor. Anyone opposed? Please raise your hand. Anyone who is opposed?
I think Tiffany had her hand up too.
Thank you.
Okay. It is unanimous. Jennifer White Holland, are you opposed? Your hand is up now. Or was that?
Sorry, I was
before?
opposed.
You are
Okay, wait a
opposed.
minute. If Jennifer's opposed, let's get clarity on what's going on.
Okay. The
Can
amendment would limit the bill or make the bill apply only to nasal administered vaccines. Administered by a parent or a guardian, not by a caregiver. That's in effect how the bill would read. Okay, the bill has been amended. Is there a motion on the bill?
Wait, I'm sorry. I
Okay.
apologize. I would like to.
That's okay.
I would like to change my vote. We're on 1135, correct?
Yes, we are.
We're on 1135, and we're on a second proposed amendment to limit it to intranasal administration.
And I will object to that. Thank you.
Okay. So the vote was 3-2. Okay.
I think it
No,
was 4-2, Mr. Chair.
One.
It was Shalega, Alston, Riley, and Lopez 4.
Okay, fine. Thank you. 4-2. We now are awaiting, is there a motion on the bill as amended for favorable?
Yes, I make a motion with the 2 amendments that were just approved. Favorable.
Is there a second for the favorable?
Second.
Say it is seconded. Is there debate on the motion to move the bill? No debate.
Yes, over here.
Oh, go ahead.
Thank you. Who's liable if something goes wrong? I mean, again, I'll go back to what Ms. Cusack said. It's parents, not trained healthcare professionals. We know there are, if you pull I'm sure the pamphlet out with side effects, it, probably be an arm's length long, and a parent's or caregiver or guardian parent or guardian, as we've defined it, is, responsible for reading that. But who is liable if something goes wrong?
Counsel, do you want to venture a response?
Well, my initial response is it probably depends on what it is that's gone wrong. I see a bunch of folks have raised their hands, but if it's a problem with the vaccine itself, you could have, manufacturer liability. If it's, if there's a problem with the fact that it was ordered for someone that it would for some reason be inappropriate for, then you have a problem for the pharmacist who's ordered it. And I think that the testimony of the proponents would be that the administration aspect is unlikely to have any particular issues if like the fact that it was ordered in the first place was reasonable and there's no problems with the vaccine itself.
Okay, is there comment on, we're then moving to a discussion of the bill as amended. Ms. Cusack, followed by Mr. Benedetto.
I just want to add quickly to the delegate's comment that this is also not being ordered by the child's physician. So you've really removed every protection for the child. It's being ordered by a pharmacist who does not know the child or their medical history. It's being administered by an untrained parent. And no one is liable. You have to look back to the federal 1986 law. So it's a huge issue.
That is a significant point. I would like to give council time to research that point about the 86 law and liability. So we will defer a vote on 11:35 until our next meeting. How much time do we have left, Lindsay?
Until crossover?
No. Until the bell rings for this subcommittee meeting.
Oh, in theory, 4 minutes, I guess.
Well,
I noticed
this
that
is our time, so I would like to begin discussion on 11:50. Health occupations, pharmacists, minor conditions, and HIV prevention and treatment. Delegate Kerr's bill. There is an amendment from the sponsor. Can council speak to what those amendments would do, or that amendment would do?
Sure. The amendments strike language relating to what drugs or devices a pharmacist may prescribe in favor of a specific list of conditions that's listed elsewhere in the bill. Strike specific conditions for which a pharmacist may order, test for, screen for, or treat. So the amendments are striking cold sores, lice, and skin conditions, including ringworm, and strikes language authorizing a pharmacist to delegate the administrative and technical tasks of performing a test to a pharmacy student or individual in a pharmacy technician training program, but adds they're a registered pharmacy intern. I would also like to raise for your consideration that the language pharmacist may order, test for, screen for, or treat, I think needs a technical amendment because order a condition doesn't make sense. I think that that's supposed to read order a test for, comma, test for, screen for, or treat. And that appears twice in the bill. And then the board has submitted testimony these amendments from the sponsor were largely incorporating board amendments, but the board has submitted separate testimony subsequent to this amendment, noting that they object to the inclusion of UTI on that specific list.
All right. Ellen Bandel.
Hi, I'm Alan Bandel. I'm actually with the sponsor of the supporting the previous bill, the 1135. I just didn't know if you wanted a response regarding, and I can come back to the questions about liability or sort of coverage.
Okay, could I ask that you deal with that offline with council?
Sure. Yeah.
Thank you. Thank you very much. Mr. Benedetto.
Hello, I'm Richard DiBenedetto, pharmacist by training, deal with HIV specifically in my clinic. And I just wanted to say the amendment in general sounds like it is a great idea to, limit specifically who can do the testing in a pharmacy to the pharmacist and then to a registered intern. I would say that as an educator, that excludes all of the student pharmacists that are out on rotations, which is where the interns are typically going to be working. They don't need an intern license to be on rotations. That is where they should be doing all of their learning and training. So I would really suggest that you not approve that portion of it. I can understand not wanting a technician to do it. I don't necessarily agree with it, but you're really severely limiting education and training programs if you're doing that change. In terms of the diseases, as long as we're including HIV, I have no problem with it. I think it should be fairly broad, but that's my 2 cents. Available for any questions or comments if you have any concerns related to the bill or questions for a pharmacist.
You might want to submit something in writing. That way it's easiest to get your concerns to everyone.
Thank
Ms.
you.
Wharton?
Yes, thank you. But we are generally supportive of the amendments that were submitted. I do want to mention one thing with the response from the Board of Pharmacy. We did have communications, and I have written communications where we discussed the modifications, and the UTI was not one of the items that they were excluding. And so my understanding is that we had come to an agreement there. And so this is a change from an agreement from February 26th. So I would have concerns about that. I'm fine with tightening the language, but would like to keep the UTIs testing there.
Okay. Ms. Martin?
Hello, my name is Dr. Martin. I'm a pediatric emergency medicine doctor in Montgomery County, and I testified during the Senate hearing on this. And I had some concerns in general about the amendments that I wanted to make clear. My pharmacist colleagues are amazing with regards to their training and the amount of information they have with regards to the drugs themselves and how they work and what drugs can be used for different conditions. Unfortunately, as much training as they have, they're not diagnosticians. And the examples that are given in the revised comments on this bill include things that can initially be thought of as a simple diagnosis, but they're not. In my previous testimony, I mentioned a respiratory symptoms of a child with a cough for a couple of days, where it's not just COVID or other respiratory illnesses, but indeed something like an inhaled foreign body that wouldn't be able to be diagnosed in a pharmacist's location. Things like painful urination, which other people have mentioned, where this could be something like a sexually transmitted infection instead. Other things that are commonly thought of, especially here with group A strep pharyngitis, that is something that I could give examples of even in the past week of somebody being diagnosed with sore throat. It's got to be strep. Here's your amoxicillin. Isn't this great? And unfortunately, it's not strep. It is something else like mononucleosis. And given amoxicillin with mononucleosis, you actually break out into a pretty horrific rash and have symptoms for a longer period of time. And so my biggest concern with this is that our excellent pharmacist colleagues aren't diagnosticians, and that seemingly simple illnesses and simple diagnoses can actually be something much more complicated, which makes me concerned about general safety.
Thank you very much.
And I'm available for any other questions if you guys would like.
Thank you. Thank you, Dr. Martin. Thank you. Delegate Zaliga.
Thank you. I think Dr. Martin said it much better than I. I thought the bill was just about HIV, and then I pull up 12-515 and 12-516. And specifically 516, it says, in accordance with the statewide written protocol established under subsection blah, 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 a pharmacist may perform and interpret laboratory results, conduct assessments and consultation, initiate, dispense, or administer. And so I have concerns. I think, like I said, Dr. Martin said it better than I. Love my pharmacists, have, good friends, but I'm interpret lab results, do assessments and consultations without, especially with children, without consulting with the pediatrician.
Thank you very much. Ms. Horton.
Thank you. If I may respond, the bill language is that the pharmacist would make decisions based on diagnostic testing. So the pharmacist isn't necessarily making a diagnosis. They're using CLIA waive tests, and CLIA waive tests are very specific, easy to use. There are about 375 pharmacies right now in the state of Maryland that have these CLIA waivers. And so the pharmacist would be following a protocol, and the protocol goes through the steps of testing, making the diagnosis, prescribing the appropriate medication. If a patient comes in and they're testing for strep and they don't have strep, there are referrals in place in these protocols. And so it's a step-by-step process. And so for all of these, it is limited and direct. And as I've mentioned in the testimony, I feel like there are 30 states that are doing this already, where pharmacists are doing this, what we call test and treat, with these protocols in place. There's no evidence that there has been harm done in pharmacists utilizing this scope of practice and doing these tests in community pharmacies or in any other practice settings where they're working. And so I think to sort of raise these red flags, like to go from it might be flu to something else, whenever a physician, I'm presuming, a patient presents themselves with these, with a cough or whatever it is, they're going to run a flu test. They're going to run a strep test or whatever it is to then figure out and go step by step. The pharmacist will take that first round, take the appropriate steps, prescribe the medication. And if it's not something, there are referrals for the next step. So I just want to say it's not just like a free-for-all. It's very prescribed, step-by-step, protocol-based decision-making. And again, 30 states. This is not new.
Caitlin McDonough, you're muted.
Yeah, sorry, and I apologize. I'm calling it from
problem.
the Senate. And just to add a little bit to what Aaliyah said, I think what we are, and I'm on behalf, in support of the bill and in support of the amended version, on behalf of Epic Pharmacies and Walmart. Walmart in particular is doing this in I think all 30 of the other states Aaliyah referred to. They built out areas in their pharmacies, like capital renovations, to kind of have a special area for it. But I think where we're seeing patients taking advantage of this is when they don't have access to what I'll think of as a traditional diagnostician, whether it be the time of day, they can't get an appointment for a significantly long time, and things like this. So this is really about kind of spreading the workforce and addressing those emergency situations. And as Leah mentioned too, under the protocols that will be developed under the board, we have, both kind of the procedure with the patient, and then, if something comes up or a test doesn't come up negative and we don't know what the issue is, there is a procedure for a warm handoff to other practitioners as appropriate. So, I think our concern is people aren't being seen at all. This gives one opportunity to get them in the door.
An additional opportunity. Yeah.
Yes. Thank you.
Okay. Thank you. Last witness will be, or last person to speak will be Delegate Hill.
Thank you, Mr. Chair. I know I'm not part of the subcommittee, but I did want to suggest whatever these protocols are, you may want to actually see them. And I think that there is a concern also. It's not so much, if you miss a diagnosis, it's not just a misdiagnosis, it's a loss of time. And that becomes a problem. I know a lot of pharmacies have built out these spaces, but they built them out for nurse practitioners and other folks other than physicians to be able to do minute clinics and all that kind of stuff. I think that we really need to be very mindful when we decide that some diagnosis is better than the right diagnosis. They may be the right diagnosis, but just assuming that because something's urgent and someone who has a familiarity with medications and has a protocol to read, we could just give the protocols to parents and tell them to read the protocols and decide what the diagnosis is. I think this is taking a few steps beyond, and it may be that if we see the CLIA test that we're talking about and what these protocols look like, I would feel differently about it, but I'm not on the subcommittee. I've just been listening, and I just had to speak up, and I appreciate you for allowing me to, and I'll come back up. Thank you.
Well, there's also one other person who's not part of the subcommittee that I think we do need to hear from, and that's the sponsor of the bill. So I think our time is up. Therefore, I'm going to once again defer or toss the ball to council to ask you to inform Delegate Kerr of the discussion we've had so that he can participate knowledgeably in our next meeting, if he is available. We'll meet at the regular time, but want to give him the opportunity to at least comment on what we're considering. All right, I'm going to seek a move to adjourn the meeting so that people can either prepare for the full committee meeting or
Move to
participate
adjourn.
in the
Second.
meeting of the
Yeah, second.
pharmaceuticals. Moved and seconded. There is no opposition. We are adjourned.